I would like to call is Dr. Churchwell and Mary McGowan. Hi, doctor. Nice to see you.
Mary.
Go ahead. All right, the floor is yours.
Great. Well, Mary, I start? Great. Well, good afternoon, Chairs Friedman and Hunt, and esteemed members of the committee. On behalf of Boston Children's, I just want to thank you for the opportunity to testify on such a deeply important topic, pediatric behavioral health and COVID-19. I'd also like to thank the committee for what you've already done in this space. It's these kinds of meaningful investments that will enable us to combat the current behavioral health crisis. And as CEO of Boston Children's Hospital and a founding member of the Children's Mental Health Campaign, I come before you today feeling great concern and even a greater sense of urgency. Simply put, children have been in a behavioral health pandemic long before COVID-19, the COVID-19 pandemic, and it's only exacerbated the need. Prior to COVID-19, the data showed that 1 in 5 children experience a psychiatric disorder within a given year, and half of all disorders begin by the age of 14. However, and this is really unacceptable, less than half of children with psychiatric disorders actually receive the treatment that they need. And as bad as things are, right now the demand for pediatric behavioral health care, as you can imagine, skyrocketed. In this climate, acute care has become the default, leading to scores of children in crisis flocking to emergency departments only to discover that there are no available inpatient psychiatric beds. This leaves children and their families in a catch-22. They arrive at our ER, too acute to go home, and wait for a psychiatric bed. And so they remain boarding for weeks at a time in a noisy and crowded environment that is not designed for a therapeutic intervention. And as I speak to you today, we currently at Boston Children's have over 33 children boarding in our ER, on our floor, in our inpatient psychiatric unit. During the past winter, we reached numbers of 50 to 70. I'm always asked the question, what do you do when you get to that number? Well, you just try to make through the day. That's what you do. And while we've doubled down on our community at Boston Children's to provide quality behavioral health care, as we're working to actually open up an additional 12 inpatient psychiatric beds this fall, I also recognize that it will take all of us working together to make sure that children are able to receive the right care at the right time in the right setting. If we don't step up now, the downstream impacts will be severe. We have an opportunity to make an immediate and sustainable impact by investing boldly in children's behavioral health now. The time is now to finally tackle the escalating pediatric boarding crisis. We can begin to tackle this problem through the development of a Children's Behavioral Health Innovation Fund. We need to invest a significant amount of dollars to comprehensively address the pediatric boarding problem. This innovation fund should support upstream investments in our schools and community to prevent boarding, as well as support children with severe and complex needs, like children with disabling anxiety and depression, with suicidal thoughts, or those with co-occurring autism spectrum disorders. In terms of upstream investments, we've seen the renewed clarity during COVID, how vital schools are to the well-being of our children. However, research from the Birch Center at UMass found that children in lower income districts have far less access to behavioral health supports in schools. This is totally unacceptable. To even the playing field, the Innovation Fund should support the implementation of the statewide school-based behavioral health technical assistance, or TA Center. This TA Center is tasked with supporting all schools, particularly the under-resourced, and providing behavioral health services. All of our children deserve this. It should not be based on race, income, or zip code. To tackle this crisis head-on, the Innovation Fund should also support the behavioral health workforce. The difficulty of working in a COVID environment has made it all the more challenging to attract and retain providers. Investment in our workforce should include strategies to attract individuals from culturally and racially diverse backgrounds, and also to retain and support the workforce that we already have. Other workforce strategies include helping pediatric primary care providers effectively manage mild to moderate behavioral health conditions so that scarce behavioral health specialists can be conserved for severe conditions. This can include increasing funding for the Massachusetts Child Psychiatry Access Program, known as MCPAP, as well as new funding for focused educational initiatives. There's much more that I'd like to say about Children's Behavioral Health Innovation Fund, and I've made sure it's included in the written testimony. But to close, I want to leave you with this truth. Our state desperately needs better systems of care for children in psychiatric crisis, and investments tailored at the right interventions can truly make a difference. Massachusetts has been a pioneer in healthcare, due to large part to our lawmakers here today, who are willing to make bold investments. So the time is now. Thank you again for your time. Happy to take any questions you might have.